We're going to start this afternoon session right now, and it's going to be about effort and fatigue effects on decision making. And we have a couple of speakers here, Anna Kuppuswamy, Shruti Naik, Marike van der Schaaf, and Matthew Abs, who will all tell you about their work and around this topic. And we open the ball with Anna Kuppuswamy, who is a professor, a principal research fellow at University College of London, where she directs the Effort Lab. So, Anna, go ahead.
Well, thank you very much for that introduction, and I'm extremely excited to be presenting my work in this meeting here. And yeah, well, thank you, Matthias, for inviting me for this symposium. Right, so let's put this on slideshow. This morning's session was fantastic. It was so much information, and what really struck me was the fact that decision-making is such a complex process. It's not just complex, but it's also extremely sensitive to the context in which decisions are being made and the different states in which the organism is, in which decisions are being made. And while we all try to control for lots of factors, some invariably gets overlooked. And oh, well, I need to click OK there. There we go. And one such factor is fatigue. Fatigue is a massive problem in pathological states, but also we all experience fatigue in various points in time. I can guarantee that right now I'm actually being the oppressively hot weather today has just taken it out of me. And my state in the morning was very different to what it is currently. So you get me to do the same task morning or afternoon, I'm going to have completely different results. So a lot of this decision making is influenced by fatigue. But of course, it hardly ever gets studied as a phenomenon in itself. The reason being, again, fatigue is not as simple as we think it is. It's a very vague term, almost a black box term, which captures a lot of different things. It means different things to different people. How do you measure fatigue? It's not, it's in no way clear. And also coming up with an operational definition of fatigue that holds true in a range of different contexts is extremely challenging, if not impossible. So I thought I'm going to, given that I'm the first speaker of the session, I thought I'll give you some context about fatigue and how fatigue can be experienced in different contexts. In fact, if you look at the, I'm just trying to look at which button am I pressing. If you look at the titles of the 4 talks in this session, we're all saying fatigue, but we're talking about very different things, actually. And to start off with, I envisage fatigue as an experience that is associated with a large number of bodily and brain states, which can be seen as being on a spectrum of physiological at one end of the spectrum to pathological at the other end of the spectrum. And if you think about the physiological states of fatigue, it is associated with repetitive activation of a circuit, be it a cognitive circuit or neuromuscular system or whatever it is. Repeated activation results in the experience of fatigue. Not only does it result in an experience, but also it alters the output of the system. And why do I actually make emphasize the sort of experience of fatigue and output of fatigue? Although they may appear to be linked on first glance, it can be significantly dissociated from each other. Just to give you an example, an elite athlete could potentially experience the same amount of fatigue, and yet their performance output does not drop. They can actually push through that barrier. So training has an effect on this association between fatigue and output of the system. So that's the physiological end. If you think about the pathological end of the spectrum, there are a range of diseases, neurological conditions, autoimmune disorders, cancer, fatigue. Well, the list is almost never ending. And at this end of the spectrum, the experience of fatigue, again, is almost always dissociated from the output, the performance of a system. So the reason I'm trying to give this background is when you say, how do you measure fatigue? Out there in the literature, you have performance metrics, you've got experience questionnaire-based scores, all of them use the term fatigue. So it's almost impossible to homogenize and pull together all of the results that we have in this field. in this sort of spectrum, I have just placed inflammation-induced acute fatigue in the middle because it does share features of both physiological and pathological states. So apart from different ways of measuring fatigue and different states in which fatigue is experienced, there is also this other layer of trait fatigue versus state fatigue. So state fatigue is something that fluctuates throughout the day. Morning, you're not tired. Afternoon, you're tired. Whereas trait fatigue is more relevant in the pathological group, where over long periods of time that extends to over weeks and months, people feel this high levels of fatigue. So it's almost never measured in physiological settings of fatigue, for example, exercise-induced fatigue, because only in pathological states trait fatigue becomes relevant. So having given this background, I operate almost exclusively in the pathological end of the spectrum. And I'm also interested in the experience of fatigue, not necessarily repetition-induced change in output of a particular system. So I am going to talk to you about two studies that we have performed recently in my lab, and we focus on stroke. So that's the cohort of interest, and I investigate post-stroke fatigue. Here's a quick background to what inspired the studies that I'll be presenting today. So there are some ground truths about post-stroke fatigue. There is no behavioral correlate for post-stroke fatigue. However, in some experimental conditions, there is slowed reaction times and slowed movement times. These metrics, again, are very broad brush metrics that it can mean any number of different things. And again, in simple reaction time tasks, there is no correlation between fatigue and reaction times. But as the task starts to get more complex, then fatigue starts to have an influence. And of course, the first question as well, they are stroke survivors. Has it got something to do with their weakness or other sort of cognitive deficits as a result of stroke? And we do know that such post-stroke fatigue, such slowed reaction times and movement times is not explained by motor deficits or cognitive deficits as measured by using the sort of Waze 3 battery of tests, including information processing speed. So that's some of the findings in post-stroke cohort. And when you look to the experience of post-stroke fatigue, patients always will tell you that, well, Anna, you're asking me to do this experiment in your nice little fancy shiny lab, and it's all very nice and quiet. I'm extremely relaxed, and I can do this task perfectly well. And you get all of your results from this study showing that there's no slowed reaction time, there's no motor deficit, there's no information processing. Just send me out of the lab, and as soon as I hit multiple sensory streams, everything starts to fall apart. Now, while you and I can perform the same task equally well in a relatively small range of conditions, being able to handle multiple sensory streams is one particular problem with the stroke survivors with high levels of fatigue, which was what inspired the study. So we were interested in understanding the interaction between fatigue and the task load and the presence or absence of a distractor. So before I move on to describe the experiment itself, for the clinicians out there who are interested in what sort of stroke, again, is a very diverse condition, and this is a description of our cohort. We had 32 stroke survivors, and there were about 19 of them had left hemispheric strokes and the rest had right, and the majority were ischemic strokes, with 3 of them with hemorrhagic stroke, and this is the typical of the distribution out there in the wild. There are more left-sided left hemispheric strokes than right, and more ischemic than hemorrhagic. And in terms of the vascular territory affected, the middle cerebral artery was affected, so in the majority of stroke survivors. And again, as I said, I'm really interested in what might be driving fatigue in the chronic phase post-stroke, and on average there were 4.5 years post the stroke event itself. And then we did a bunch of measures before we did the experimental session. Trait fatigue was measured using the Fatigue Severity Scale. It is a 7-item scale that gives you a measure of how their fatigue levels over a period of 2 weeks leading up to the day of the study. And state fatigue using the visual analog scale gives you a a measure of the fatigue at that point in time when they performed the experiment. And as you can see, there was a strong correlation between the trait and state fatigue, which is normally not the case, but we can go into it if you're interested in the discussion. And on average, they were just over 60 years of age, which is a bit lower for the normal sort of stroke age group. And we also measured the grip strength and 9-hole peg tests, which is a measure of power and dexterity. And as you can see, the affected sides power and dexterity was about 90% on average of the unaffected side, which means they were practically normal people. So they're very well recovered from the stroke from a physical perspective. And they also were not depressed or not anxious. We use the hospital anxiety and depression scale. So a cutoff of 11 is normally used as the threshold for that's associated with clinical depression. It's not a diagnostic tool, but there is a correlation. And as you can see, this was a very tightly controlled group of pure fatigue, where there's no comorbid impairment or comorbid mood disorders. And also none of these measures correlated with their trait fatigue. So what I would say is we are measuring primary fatigue here. Right, so moving on to the tasks that we performed, we did a visual selective attention paradigm, and the idea was to recreate this real world situation of distractors interfering on performance of an attention task. We used a relatively simple visual attention task. We presented a stream of crosses of varying colors and orientation. And there were 3 load conditions. The low load condition only had color as the feature. A single color was needed a response of a button press. And the medium loads, they had to pay attention to 2 different colors, irrespective of the orientation. The high load condition, they had to pay attention to both the color and the orientation. And all of these conditions were presented either with a gray background, as shown in panel A here, the gray background, or in the presence of a flickering checkerboard. The checkerboard was flickering at 10 Hertz frequency, and here are the sort of numbers that we used. So we had 12 blocks, and each block had 4 streams. So you can see each block was under 2 minutes, and this was specifically designed for people who had high levels of fatigue when they came into the lab. So we had to be very careful. We had to sort of balance out the number of blocks with will we have good quality EEG data. So we did a time frequency analysis, and this is just a grand average of all of the conditions. And you can see there is a clear increase. There is a 10 Hertz peak in the posterior electrodes, confirming that we did actually manage to elicit distractor-related activity in the visual cortex. So these are the 5 electrodes we used for all of the analysis from now on. And what did we find? We did find, I'm just going to go through the behavioral results first, and then I'll talk about the EEG results. When it comes to, we looked at response time and accuracy. And as you can see here, with increasing load of the task, there was an increase in response time, as you would anticipate. And this is both in the flicker off and the flicker on condition. And interestingly, flicker did not have an effect on reaction time with increasing load. And the same was found with accuracy. There was a decrease in accuracy with increasing load. However, flicker did not have an effect on accuracy. What was the relationship between fatigue scores and the x-axis? The y-axis here is it was delta response time. So we looked at the difference between the conditions rather than the raw response time values, simply as a way of normalization. And what we found was, although there was a trend with increasing FSS or fatigue, there was a greater difference in the reaction times. However, this did not reach significance. So it appears as if there is no effect on the behavior per se. So what about EEG responses? What we found in the EEG was that this is the grand average of across between the load conditions. collapsing across the flicker on and off. And the middle graph is collapsing across the load conditions, but the difference between flicker on and off, and this was the interaction between load and fatigue. This is simply for visual representation. And when you look at panel A here, this is, sorry, I did mention that the checkerboard, which was the distractor, was presented at 10 Hertz frequency, but the target was presented at 4 Hertz frequency. And we looked at 4 Hertz power. And interestingly, there was no effect of load on the 4 Hertz power. And there was also no effect of flicker. But with 10 Hertz power, as you would expect, in the flicker off condition, there was no modulation with load. However, in the flicker on condition, there was a significant difference between the low and low and the high and medium and high. So it's not very obvious the direction of change. So therefore, in panel C, we have zoomed in on the y-axis, and you can see that as the load increases, there was a reduction in 10 Hertz power. Now, remember that 10 Hertz is a measure of distractor processing, and in keeping with the sort of the perceptual load theory of attention, 2 minutes, sorry. Okay, in keeping with the perceptual load theory, there is an attenuation of distractor processing, because they are focusing on the target as the load increases, so therefore they have to suppress the distractors more. Let's ignore panel D because that's the flicker off condition, but when you look at the association between fatigue and this change in 10 Hertz power between the load conditions, interestingly, what we found was there was a significant correlation, meaning those with high levels of fatigue had a smaller attenuation of 10 Hertz power with increasing load, which means that they were unable to suppress successfully the distractors while performing this attention task. But remember, they did not actually seem to affect their behavior. They were still able to accurately perform the task, and yet they were unable to suppress these distractors. And this, I believe, is the cause of, or at least one of the causes of the experience of fatigue while there are multiple sensory streams, despite the behavioral output being very similar to non-distractor condition. Okay, so I'm going to quickly run through the results of another study where we used an auditory oddball paradigm, because when patients do talk about visual inputs being overloaded, but also auditory input. In fact, in the order of distraction or intensity of how these different sensory streams trigger fatigue, auditory is first in line, followed by visual, followed by synesthetic sensory input. So we thought we will do an auditory oddball paradigm. We did not do frequency time spectrum analysis. We looked at evoked potentials. And here again, similar to the visual task, we presented a stream of standard target tones interspersed with standard tones interspersed with targets and novel tones. And here the idea was to test the difference between top-down versus bottom-up potential processing. And again, I won't go through all of the details, but in this auditory selective attention task, there was actually an influence on behavior per se. The response time was also was modulated both by noise and fatigue. And accuracy, again, was unaffected by both noise and fatigue. Effort rating was, again, surprisingly not affected by fatigue, but was affected by noise. Both groups of high and low fatigue did say that the distractor condition was more effortful. And if we quickly run through the evoked potentials, we looked at three components, the N100, P300A, and P300B. So one was a sort of established metric of perception, and the other two are attentional metrics. So looking at P300A, which is the second deflection in the average trials of EEG, the top A panel represents evoked potentials from the high fatigue group, and B represents from the low fatigue group, and the red trace is in the no noise condition, and the blue trace is in the noise condition. As you can see, there is some slight differences which has been quantified using and on the panel A here, you can see that there is in the noise off condition, there is no difference between high and low fatigue, whereas in the noise on condition, there appears to be a difference. In panel B, we have represented the same data in a slightly different form, which is the change in amplitude with the introduction of noise in the high fatigue is significantly different from that of low fatigue. And again, P300A is a measure of novelty stimulus processing. So therefore, bottom-up processing appears to be more affected than top-down processing, which you will see in a minute. And again, there was some effect of latency, but in interest of time, I'm just going to carry on. There was no effect of either noise or fatigue on P300B, whereas with N100, there seemed to be an effect of noise, but no effect of fatigue whatsoever. So to summarize, what I've shown here is with increasing target load, suppression of distractors is attenuated in post-stroke fatigue, and such poor distractor suppression in high fatigue does not appear to interfere with rule-based decision-making. However, it does seem that there seems to be a greater effect on bottom-up attentional processes than top-down, which all of this is in line with the sort of self-reported experience of fatigue of sensory overload. And I believe, although this is a mechanism that we have identified in stroke survivors, it could apply much more widely. And if we just think about, when we're down with flu, pretty much all of the sensory stimuli tend to be overwhelming, and you'd like to sort of lock yourself up in a dark room, or at least I do. So I'm guessing there are similar mechanisms at play in when someone experiences fatigue, and of course it doesn't appear to have an impact on behavior, but again the task might not be stressing the system enough to pick up the differences. Anyway, I'll stop here, and I'm happy to take any questions. Thank you for your attention.
Questions?
I'm wondering, where they have stroke, and might have any specific influences on which sensory modality they might have trouble suppressed.
That's a good question, but so we have, there's plenty of work out there to show that lesion location does not track severity of fatigue or incidence of fatigue for that matter. And it appears as if it is more maladaptive processes that seems to be driving fatigue, as opposed to the sort of acute location-based effect on fatigue. It's a sort of separate area, but it doesn't seem like the stroke location has an effect on fatigue itself.
Yeah, I mean, that for example, if the stroke area is too close to the auditory or visual stimulation, like regions, whether they might have developed these particular inability to deal with sensory information.
Yeah, they don't actually exhibit any deficits in hearing per se, or even visual processing. And of course, visual neglect appears to be delinked from post-stroke fatigue. And so so although vision is completely normal and hearing is completely normal, the sensory overload seems to be not necessarily linked to the location of the auditory cortex themselves. It's the tensional stream, so it's outside of these cortices. So it's unlikely, I think, the results that we're seeing are driven by lesion location.
Questions?
Actually, I had a similar question, so maybe I can follow up. Okay, so I understand it's not related to the location of the lesion, but then what could be the mechanisms? What I'm lacking is, why would a stroke induce or impair this distractor suppression in your patients?
Okay, so there is a big debate in the field, and in fact there was one paper published talking about well, is post-stroke fatigue a separate phenomena that is delinked from the stroke itself? In fact, is all chronic fatigue delinked from the primary disorder of, so stroke is undoubtedly the trigger, But in terms of what is, interestingly, some of them develop fatigue in the chronic phase. They don't actually present with fatigue in the immediately post-stroke or even the first 3 months post-stroke. So this almost suggests that it's the cascade of events that stroke has started off, which then we still don't know. We haven't mapped out what are the different events. And somewhere down the line, not all stroke survivors suffer from fatigue. So clearly, we are yet to track the series of events that then results in one small cohort not being able to suppress distractors. So I think we'll probably get very hung up if we sort of start looking at lesion location. That's where the field has gone wrong, I think, all these days, because it's just been looking at, oh, well, let's find that magic area that would then tell us whether someone is going to go on to develop fatigue or not. Having said that, thalamic lesions, there's some meta-analysis now where they're talking about thalamic lesions. But the thalamus has to be part of the network that is affected for fatigue to be experienced post-stroke further down the line. So they're not necessarily thalamic strokes, but it has to be part of a wider network. So I'm thinking gain setting somewhere in the sort of higher order thalamocortical loops, but there's very little information, unfortunately.